You will say, well, I know what causes health. Well, heart disease and stroke and cancer, etc. So that's not quite right. And I want to illustrate what causes health with a story. This is a blues man. His name is Blind Willie Johnson. So this is the only known photograph of Willie Johnson. Any of you who like the blues will know Blind Willie Johnson. He was born at the turn of the 19th century in Texas. And he was born in Texas. He was poor. The story is that when he was 3, his mother threw lye in his eyes in an act of domestic violence, and he became blind. He lived fairly poor. He learned how to play the guitar. He made money playing the blues, and he busked, essentially, is the way he made money. He was married. He lived in a house. The house burned down. He had no money, so he continued living in the burned down house. And when he was 44, he developed malaria. So Blind Willie Johnson, who was blind, poor and black in Texas, and this is now in the 1940s, his wife took him to hospital where he was turned away. Unclear whether he was turned away because he was blind, because he was black, because he was poor, and went home and died. So the question is, what killed Blind Willie Johnson? Well, obviously malaria killed him, right? But it wasn't just malaria that killed him, right? It was his malaria, it was racism, it was domestic violence, it was poverty. All of that killed Blind Willie Johnson. Malaria didn't get him. Something else was going to get him any day, right? Now, why am I telling you this obvious story? I'm telling you this obvious story because unless we ground a conversation in the foundational causes of health, unless we understand that if we fix malaria and we don't deal with the racism, with the poverty, with the domestic violence, we are not going to fix health for all.